Most people know that Medicare has 4 parts. We refer to those as A, B, C, and D. Now, each of these 4 parts covers a different aspect of our healthcare needs and also has its own set of rules and regulations. In this video, we're going to examine one of the very unique rules about Medicare Part A that oftentimes people misunderstand and actually make mistakes around. And we don't want that to happen to you. So we're going to get into the details of this particular rule. Now I'm going to get into the specifics of that rule that you have to understand, but before I do, I think it's critical that we understand first off this issue here that has to do with the eligibility of Part A. So as we're talking about Part A of Medicare, how are we even eligible for that? Well, the key to being eligible for Medicare is having 40 quarters. 40 quarters equals 10 years worth of work, and during those 10 years we've been paying into the Medicare tax system. Right now, if you're working for someone, you pay 1.45% of every dollar you make. Your employer matches it. If you're self-employed, you pay the full 0.290%. So we are funding Medicare. And as long as we have this 10 years worth of work, 40 quarters paid in, then we actually get Medicare Part A at zero. There's no cost for it as far as the premium. So we call this premium-free Part A. Premium-free Part A. And they tell us right now that 99% of the Medicare population is getting it at zero cost, 99%. Why? Because they have 40 quarters, 10 years worth of work where they paid Medicare taxes, or maybe they're getting it from a spouse or even an ex-spouse, even a deceased spouse. But we have to have 40 quarters to get it at zero premium. Now, some people don't have 40 quarters. We have people that may have between 30 to 39 quarters. So they have to buy Medicare Part A, and that right now is costing $278 a month. Now, I will tell you this. If I have somebody that's real close to 40 quarters, I encourage them, if they can't, go back to work, because it's nice to be able to move out of this column here and go to the zero column if we can go back to work. And so what happens is we earn a quarter by earning $1,730 this year in 2024. That's W-2 income, net self-employment income, and we report this to the IRS, and that gives us a quarter. So how do I pick up 4 quarters? The most I can pick up in a year, I make 4 times that amount. So if I make $6,920 this year, I just picked up 4 quarters. So if I'm real close, go back to work and move up to the zero column. Now the third group of people are those that have less than 30. They have 0 to 29 quarters. They actually have to pay $505 a month for their Medicare Part A. And again, they tell us that about 1% of the Medicare population has to buy A, and 99% of it are going to get it at zero premium. All right, so here's why I'm teaching you this. When we talk about penalties in Part A, you have to realize that this is the only group of people that are ever penalized in Part A, those that have to pay for it. Because if we go without Part A when we should have it, they assess a 10% penalty per year and those 10% penalties are added to our premiums. So if I'm up here, I can never be penalized for it because it's zero. What's 1,000% of zero? It will be zero. Okay, so that's eligibility. Now let's get into the rule. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. And these rules that we're going to look at now have to do with enrollment into Part A. There's several different scenarios here that I want you to be clear about so you don't make some kind of mistake. So here's the first scenario. When enrolling into Medicare Part A is automatic. Automatic. There's a group of you that will be automatically enrolled in A as well as B. Why is that? Because you are already receiving Social Security benefits. All right, and as you approach 65, Medicare is going to automatically enroll you into A and B. That Social Security benefits could be retirement Social Security, could be spousal benefits, it could be survivor benefits. You're going to be automatically enrolled if you're receiving any form of Social Security benefits. Now, if you're receiving disability benefits, those Medicare benefits start on the 25th month of having received your Social Security disability. Okay, but the rest of us, it starts whenever we turn 65. And they actually mail us the Medicare A and B card about 100 days prior to our birth month. So if I'm born on the 2nd day of the month thereafter, I start my Medicare my birth month. If I'm born on the 1st day of the month, they move me to the previous month. So if you're born July 1, start Medicare June. Born December 1, you're going to start Medicare in November. But if I'm born on the 2nd day thereafter, our benefits are going to start on our birth month, automatically enrolled into Medicare A. All right, now the second scenario is this. When self-enrolling into Part A is required. Okay? Now, these people are not on Social Security, or they would have been automatically enrolled, but they're still required to start their Medicare benefits, A and B, at 65. Well, who's that? Anyone who's no longer working, or their spouse is no longer working, meaning we have no employer insurance available. Anyone that is on COBRA insurance has to start at 65. Anyone that's on TRICARE, retired military, got to start at 65. Anyone that's on an Affordable Care Act plan, you went through the healthcare exchange, you're going to start Medicare at 65, or anyone that is still working, or their spouse is, and they're covered by a group plan that has 19 employees on the payroll or less. Okay, that's considered a small group, and you have to start Medicare at 65. Okay, those are the 5 groups of people. So that is when it is required to enroll. You weren't automatically enrolled because you weren't on Social Security, so you have to self-enroll. You have to initiate that enrollment. Now, the third group of people would be those when enrolling into Medicare Part A is optional. Optional. Okay? Not on Social Security. You are not required to take Medicare because you're still working. And the key to this is you work for an employer that has 20 employees or more on the payroll. It's not about being insured. It's about how big is the payroll. So if there's 20 people on the payroll or more, part-time or full-time, doesn't matter. Those people then, 20 or more, that means that you don't have to take Medicare A or B. It is totally optional. Now, you may decide you want to take Medicare A, and that's fine if you decide to do that, and I'll show you some of the rules about that here in just a second, but I want to make sure you understand it's optional. You don't have to take A, you don't have to take B, as long as you or your spouse are still working, covered by an active employer-provided plan, 20 employees on the payroll or more. All right, now that's that group. Now, the fourth group, I'm going to talk about is when enrolling into Part A is a mistake. Is a mistake. Okay? And so what I mean by that means if you choose to enroll into A, you have made a mistake. And again, this group of people, it was optional. They could do it, didn't have to. And if they do it, they're going to make a mistake. And this would be someone, again, that is working or their spouses were covered by a group plan of 20 or more. And the reason it's a mistake, you opted to do it, is because you are actually contributing to what is called a health savings account. Because when we take Medicare A, and a lot of people do this, they keep working, but they go ahead and enroll into Medicare A only. When they enroll A only, then they can no longer put money into the HSA. Now, the HSA money you have in there is your money, but you can put no new contributions in. So by enrolling in A only, in my opinion, you just shot yourself in the foot. HSAs are wonderful. You put money in, your employer does. Right now, this year, we can actually put in $4,150 a year into an individual HSA, $8,300 if it's a family. And if you're over 55, you can put an extra $1,000 in. So you can put in over $5,000 a year into a healthcare IRA called a health savings account. And I would much rather have an HSA than enroll into A only. There's really not a great benefit to you at all. Now, listen, if you don't have an HSA, in other words, if that's not an option, then that's why I'm saying up here it's optional. It's all right to enroll into A only. I don't mind you doing that. In fact, I recommend it. But if you have an HSA, you have made a huge mistake, in my opinion. Keep contributing to the HSA. That money goes in tax deductible. If it's a growth account, it grows tax exempt, tax deferred. And as long as you use that money for medical expenses, you'll never pay taxes on it. It's permanently tax exempt. All right. And so we love HSA. So these are the different scenarios when it comes to Medicare Part A. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. Now, in addition to understanding the enrollment rules, you have to also understand what we call the coordination of benefits, meaning how is this going to work with Medicare? Coordination of benefit means we have a couple different insurance plans. Could be Medicare, could be a supplemental plan, could be Medicare and employer plan. So you have to know which of these insurance plans is going to pay first. How will they coordinate a claim if you have a health claim? All right, so let me show you how this is going to work. So if someone is no longer working and your spouse is no longer working, who is going to pay first? Who's going to pay second? Well, the first payer is always going to be Medicare. Okay, so if you're on that Medicare A, no longer working, Medicare is going to pay first. And the second payer is you. You're actually the second payer, so you're going to self-pay, or you're going to go out and buy some kind of an insurance plan to cover your responsibility. But the point is, Medicare is always first if you are no longer working, meaning we have no employer plan available to us. Medicare always pays first. Number two, now we could be in a situation where you're still working. This again is you or your spouse covered by an active employment provided plan. And notice here's that 20 plus number again. So 20 or more employees on the payroll. Then who's going to pay first? Who pays second? Well, you're going to see here that that group plan at work, that insurance plan that you are getting from your employer, is always going to pay first. And then over here, the second is going to be Medicare. So if you happen to enroll in that Medicare A and you have a claim 20 or more, your group plan is still first, and then Medicare A is going to pay second. Now that's why I was saying earlier, if you have an HSA, I would not enroll in a Medicare, because Medicare is still going to be in the second payer position. And in the second payer position, they will pay no deductibles, they'll pay no copays, only coinsurance. So if you have an HSA, I would much rather keep that HSA going and fund that as enrolling into Medicare A. Now, if you don't have an HSA, again, you enroll into A only, no problem. But again, your group plan is still going to pay first, and A is going to pay second. And then the other scenario here is you're still working, right? But we have a small group. Medicare defines that as 19 or fewer employees on the payroll. This is where it changes. Now, first payer is going to be Medicare. Has to be, and then your company plan, your group plan, or some other kind of insurance that you have is going to be the second payer. And this is why I said earlier, if you continue to work and you have a small group, you have to enroll in Medicare A and B to put Medicare in the first payer position. And if you don't do that, that group plan still pays second. Who do you think pays first if you don't enroll? You do. And this is a mistake that people make all the time when they're in small employer plans. Now, you would probably never find out you made a mistake unless you had a large claim, but I can assure you, you have some a cancer issue or a surgery issue, and those claims start coming in. It's a small group plan, and once they come in and they realize, well, we're covering you, but Medicare is going to be the first payer. So if you don't enroll in Medicare, you're the one responsible to pay. All right? And so I want to make sure that you understand these rules, because if you mess these up, you can have terrible penalties as a result.